Hi guys, this is Charles. I'm one of the surgeons at Southpaws. Today we are removing this mass from the inguinal region of a female spayed Dog de Bordeaux, biopsied previously as a hematoma. CT scan showed that it was not particularly invasive, but it was right up against the femoral artery and femoral vein. And so what I'm concerned about is that there's some underlying neoplasia and that it's not just a hematoma. So that's why we've decided to go ahead and remove it based on the owner's wishes. If you haven't already done so, please subscribe to our channel and make sure you turn on notifications so that you know when we are live streaming the next time. Sorry, James, what's... So I'm just doing kind of a marginal excision as far as the skin is concerned, but in this area, that's still going to be too much tension, I believe, to close it primarily. So we're probably going to do a flank fold flap to provide some skin in order for us to close it without any tension. If you have any questions, we do have the chat going, and so you can feel free to ask them. And if I'm not too busy, I'm happy to answer them as we go along. Hope everybody's doing okay out in COVID land. Things are pretty crazy here, although thankfully vets so far are considered essential businesses, and so we haven't been asked to shut down. Nobody's contacted us yet about ventilators or anything like that. So, so far it's kind of business as usual, although we are taking a lot of precautions in order to reduce client contact and also to increase or improve our hygiene at the hospital. You can see because the skin is under a bit of tension here, the wound is just going to really gape open as we cut through the skin, and it's going to create a lot larger defect than what we initially would have anticipated based on how much skin that we're removing. Doing a little jumping, not because the dog can feel it, but because we're directly stimulating nerves and muscles as we use the electric cautery. So the vessel there is that, yeah, I think that's caudal superficial epigastric vein there. Trying to ligate that before we cut it. The kelpies aren't even big enough here. Can you just retract on that for me, please? Thank you, Sarah. And the key here is going to be getting my plane of dissection between the tumor and the femoral vein and artery, and I can certainly sacrifice those if I need to. Maybe retract on that for me, please. So I'm trying to maintain a little bit of a margin of soft tissue around the mass here, and we're getting, this is where the femoral artery and vein will be, right down in there. There's some thought possibly that the mass could be caused by recurrent bleeding from a branch of the femoral vein, probably. So that's a possibility as well. So we'll have to look for any bleeders, feeder vessels as we go. So we're down to body wall right there. So we've gotten past the femoral artery, which is sitting right there. I can feel it pulsing. Sarah, do you want to feel that? So managed to avoid that. So we should just be able to lift up like that. I'll get rid of this guy. It's not doing me any good. Do you need a stool? I have to decide whether I need to take any abdominal wall as well. I don't think so. That wasn't loud at all, Camille. Thank you. Any important questions or anything, Camille? So the biopsy said that it was a hematoma, although based on its appearance and behavior, I'm concerned that it could be something else, like either a bleeding hemangiosarcoma or soft tissue sarcoma or something like that. And so based on its appearance, I advised the owner that I would remove it if it were my dog, and they've elected to go ahead and do that. How do you determine how far it is? So I'm going based on the feel of the tumor and what it looked like on the CT as far as how much margin I need to take. It was very, very well circumscribed, and so I'm not being terribly aggressive. Yeah. So we would have pre-meted with methadone and acepromazine, and then induced with alfaxan, maintenance with isoflurane, and then we are giving fluid boluses for hypotension, and we don't have it on a fentanyl CRI. So that's the mass there removed, and we can feel the connective tissue around the mass is really loose and movable. And so my feeling is that this is very likely to be a complete margin. I still obviously don't know what it is. I have a feel of how much tissue we have here to decide what we're going to do to close it. So you could pull it down and close it like that, but I'd be concerned that it would be under too much tension. So I think we will take a flap of skin from here, the front of the stifle. Can I get some more towel clamps, please? Just use this one. Just pull that across temporarily while I take my flank fold flap up here. Hold on to that. Let me just turn around and see if there are any other questions. So we don't have a grade on it because it just came back a benign hematoma. Question if I'm a dog or a cat person. I have to admit that I'd probably be a dog person just because I've always had dogs. I've had one cat in my life that was an amazing cat, but tendency is more toward dogs. Let's see what we have here as far as extra loose skin. Keep that pulled down like that. I don't want to create too much tension in the skin in the recipient or the donor site. So that's the flap that I'm going to take there. Blade. We have a lovely new family member who's a lab, 14 months old now, named Humphrey. He's absolutely gorgeous and completely spoiled. This would be a flank fold flap. I think there's a more scientific name for it, but I can't remember what it is. It's not based on a particular vessel. It's just based on the plexus of vessels that are in this area, so it gives you lots of redundant circulation. It's a very robust flap.
Sue's asked a funny one. Somebody asked me if he's going to put in a drain.
That's a good question, and
With a smiling face.
And I honestly, depending on the dead space that I have in here, this may be an exception to my rule of never putting in drains. I'll just have to see once I get that flap across what it looks like. So this may be, I'm still on the fence about it a little bit, may be a situation where I will decide to put a drain in.
Do you specialize in soft tissue surgery?
There's no such thing as a soft tissue versus an orthopedic specialist in Australia. So if you're certified as a surgeon, you're certified in both soft and hard tissue. If I had to choose, my choice would be generally soft tissue and neurosurgery. I do orthopedics when I have to, just because that's kind of what pays the bills. But luckily we're fortunate for me, we have lots of surgeons who really enjoy and excel at orthopedic surgery at our practice. And so for the most part, I can defer those cases over to them. So I'm just using my towel clamps to try to kind of approximate the skin before I actually start suturing. So that looks pretty good like that. 2 PDS, please. Thank you. I reckon that's kind of how it's going to come together. I'm trying to close some sub-Q here before I do my intradermal, my donor site. Okay, so that's coming together nicely there. All right, so what we'll do, Sarah, is can we get another 2 PDS, please? So I'll get you to just put in some interrupted sutures like this.
Sure.
So just from that connective tissue down there to the similar tissue over here, kind of like that.
Okay. Someone wants to know, Charles, what they have to do veterinary neurosurgery.
So first you'd obviously go to vet school. Generally, you'd do a general internship, and then you'd get either a surgical residency where you would do both neurosurgery, soft tissue surgery, as well as orthopedic surgery, or you'd become a neurologist and preferably go to a program where they do neurosurgery as well as medical neurology. And so different programs around the world are different with respect to whether the neurologists do the surgery or whether the surgeons do the surgery at that particular facility. And So I don't think you can I don't think that there are a lot of just veterinary neurosurgeons. I think they're either general surgeons that like doing neurosurgery, or they are neurologists that also do neurosurgery.
Someone wants to know if you're planning on live streaming any more surgeries today.
I am planning on live streaming something if I can. I think I've got a ventral coxofemoral luxation. So I'll be doing a medial approach to the hip. Depending on what surgery theater I'm in, I'll decide, or I'll see if I'm able to live stream it. The problem with these flaps is that you can't close dead space like you normally would like to, because you can damage the blood supply. So normally, like if you had an incision like this, you'd love to be able to suture the middle of the flap down to the bed. But in this case, we can't do that. And so there is quite a big pocket here. So I'm not totally sure what I'm going to do here yet. You guys may see me put in my first drain in a long time. All right, so that's all going to come together really nicely. Yep, I'm afraid I'm going to have to do it. Can I get a Jackson Pratt, please? Question about what undergrad I did before vet school. I was at University of Florida, and I did zoology as my undergraduate program, but then I got into vet school before I finished my zoology degree. And so I didn't complete that. All right, so I'm just going to push this out here. Hopefully not skewer any big vessels.
What things do you consider when deciding if you truly want to drain?
So the reason why I've decided to put a drain in here is because there's so much dead space and it's a high motion area. And so I'm worried about a big seroma forming underneath here, and I cannot close any dead space underneath. So that's why I've decided to do a drain.
As a young high schooler pursuing vet med, what is the most important thing for me to start mastering right now?
You need to just get really good grades in high school so that you'll be able to get into a good university program and start getting a good foundation in sciences now, like your chemistry and biology, physics, things like that, because that's going to give you the best foundation for when you start uni in order to do well on your prerequisite courses, would be my advice.
The South Coast offer internship shadowing opportunities for pre-vet students. I do it for my undergrad in zoology.
So I understand you're at University of Florida. So we do have internships, less so for pre-vet students than we do for veterinary, like actual veterinary curriculum students. If you wanted to come after all this mess is over with coronavirus and spend a couple of weeks with us, you'd be more than welcome to. We'd love to see you. We're just kind of waiting to see how all this shakes out before we start scheduling any more internships or externships.
And as a vet in South America, can I work as a vet tech in Australia?
You can work as a vet nurse in Australia. You just have to get a work visa. You cannot practice as a veterinarian without going through the whole equivalency program, unless you've gone to a AVMA accredited vet school. But you can work as a vet nurse here, the equivalent of a vet tech. You can probably start going to a continuous if you'd like, or I'll just meet you there. I'll just do a continuous from my end. If you want to start closing maybe that area right there. And I was debating whether I was going to start live streaming again in the middle of all this mess with Corona, but then I figured that there probably would be some people that are quarantining and are bored. You'd have to be bored to watch this, but...
So the risk in complications of corona is greater than the risk of infection with the drain?
In my opinion, in this location, and it's a tough call one way or the other. The risk of infection, well, drains do increase the risk of infection. It's not a terribly high risk, but in this location, I was concerned about a seroma developing, which again can propagate the development of an infection. So that's why I decided to do a drain.
Intradermal or external stitches for reconstructing surgery?
I'm going to do intradermal sutures, and one of the main reasons why I'm doing intradermal is that we're trying to reduce the number of rechecks that we do with coronavirus. So we're trying to do more phone rechecks and stuff like that. And so I'm going to try to do all intradermal absorbable sutures rather than external sutures. And that's not too different from how we do it anyway, but we're paying particular attention to trying to do just intradermal sutures right now. And because we've got a closed section drain, we have to be careful to make this an airtight and watertight seal as well. Otherwise, the closed suction drain won't work. Maybe some 3-O-monosin, please. We're going to have to get this patient back to pull the drain out anyway. But that'll be sooner than 2 weeks. Yeah, that's great. Thanks. You happy for me to take these out?
Yeah.
So just do a continuous intradermal and meet up to what you've already done there.
Will you consider streaming laparoscopic cases?
I will stream laparoscopic cases when I get them, but we haven't had any in a while. I'm not sure exactly why not. And I'm just trying to move my light. Thank you.
Have you ever done liposurgery?
So, question about liposurgery.
Micro.
Microsurgery. Microsurgery, I have not done like major microsurgery. I've done some laboratory work, but as far as reanastomosing tiny vessels and stuff like that, I have not done that. We repair small blood vessels sometimes, or large blood vessels sometimes, like vena cava and that kind of thing. But as far as doing anastomosis for microvascular, like flaps and things like that, I have not done that.
Someone asking what breed it is.
This is a Dogue de Bordeaux. Probably, well, yeah, I'll say it's a Dogue de Bordeaux. That's what we were told, although it looks like it might have some Staffordshire Terrier mixed in.
And someone's interested in cost.
So the cost to the client for the surgery was about 4,300 Australian dollars, which is about $10 US now.
Do you ever perform emergency surgeries, example, acute traumas?
So we do emergency surgery, and the most common emergency surgery I would do would be spinal surgery for acute disc ruptures with paralysis. We do some gastric dilatation and volvuluses. We do some fractures, diaphragmatic hernias, things like that. Because we don't have an emergency center attached to our clinic, we probably do less emergency surgeries than some other referral hospitals that are affiliated with an emergency center.
You're the only one who does such great live streams.
So regarding the live streams, I think there's another guy in Russia that does a few. I'm not aware of anybody who does as much as we do. And I'm trying to get the other surgeons here to start doing it with relatively little success. Incidentally, we've got a lecture tomorrow night on why fractures fail, and then I'm also probably, other person that was going to be lecturing as well on veterinary coronavirus is not available, and so I will take over and probably do a lecture on top 10 tumors, I think is one that I have prepared, or something similar, and so I'll be doing that tomorrow night as well. That's 7 p.m. Melbourne time. And you should be able to go to our homepage on Southpaw's Vet YouTube channel and get a link to the live stream. Can I get another set of smaller DeBakey's, please? Thank you.
What does this procedure cost us?
So our costs on something like this would be, in Australia, you have the price to the client, which let's say is $4,400. And we pay 10% of that straight to the government in form of GST, or goods and services tax. So that brings the revenue to the hospital down to about $4,000. And our margin would be somewhere around 10%, which means that our costs would be about $3,600. And so the profit would be around $400 on a case like this. That's after all the consumables and electricity and rent and paying all of our staff. Our majority of our expense is wages, is staff costs, as it would be in most businesses. Definitely most veterinary businesses. Next highest lump cost would probably be consumables or disposables in America, which most practices pay probably somewhere around 15 to 20% of their gross revenue in consumables.
Are you the head surgeon at the hospital?
I started this hospital, came to Australia 16 years ago, 15 and a half years ago, and I started working at an emergency center. And then about 11 years ago, I started this hospital, and I do a lot of surgery, but some of the younger guys, I'm doing a little bit less surgery now and more administrative stuff. So right now I'm doing 2 days a week surgery, 2 days a week administration. In the past, I would have been the main surgeon in the hospital. But we've been training lots of young surgeons. We have 7 surgeons now at our hospital. It's a bit tricky when you only have 3 surgery suites. So sometimes we lose a bit of efficiency because we have too many surgeons trying to get into a limited number of spaces. And this dog has done a poo under the blanket. So I'm glad you can't smell through the television or through the computer. Exciting, we've passed the 2 million view mark, which is kind of cool. You get some 2 nylon to do a finger snare, please.
What does it cost to outfit a surgical suite?
A lot. Tough question. So one surgical theater without instruments, just with equipment, you're probably looking at, if you bought everything new, a couple of $100,000. If you buy things secondhand, you can get away with a lot cheaper than that. But then when you talk about all the support equipment to like CT scan and all the fluid pumps and cages and all that stuff, you could easily spend a couple $1 million on a hospital, like without batting an eye. don't know if you guys can see that, but Sarah's doing a really nice job doing a purse string around the drain. So while I have broken my rule about using a drain, definitely no Penrose drains. This is a closed suction drain, which is much less likely to wick bacteria back up into the wound. Sarah, can I leave that for you to finish? All right. So I'm going to get out of Sarah's way and let her finish up suturing. I'll just see if I can zoom in on her purse string that she's circumferentially around the tube. You can see there, and then she's going to do a finger snare to keep that tube in place. So I'll zoom back out so she doesn't get nervous. And so we're just going to complete that intradermal suture all the way around. Just come over and make sure that there aren't any questions that I haven't answered. So that's a really good question from Sonura about if it was a more aggressive tumor in the same location requiring deep margins, what muscles and other tissue would you sacrifice? So I would be happy to remove femoral artery, femoral vein. Clearly, femoral nerve would not be something that we could sacrifice. Hopefully, we'd be able to avoid it. We could take out pectineus muscle there. We could take out sartorius muscle without any problem. You could take out abdominal wall if you needed to. So those are the things that we would be thinking about. Question about when we'll remove the drain, probably in about 3 days. We'll have the owners come back and we'll pull that out. Let me see if there are any. So question about why I don't operate on cats as often as I operate on dogs. So when I was in the US, I was about 50-50, cats and dogs, but in Australia, there are fewer cats. Fewer cats here, at least not ones that are in people's homes. There are a lot of feral and stray cats. And so that's why, so my caseload is probably about 85 to 90% dogs as opposed to cats. Let's see if there's anything. Question about atropine. We used to use atropine in our pre-med, but now we only use it if we need it. Let's see. So regarding how long it takes to become a good surgeon, so vet school, so undergrad is 3 or 4 years, vet school's 4 years, internship's a year, probably takes a couple of years to get into a residency, 3 years of residency, 2 years to study and complete your exams, and then probably another 5 years of experience to get, to the point that you're really competent and comfortable. And so I think that's about it. Anyway, hope everybody's safe and well and haven't been too disrupted by recent current events. I will try to live stream something later on today. Thanks everybody for watching. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications.